Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the series of lectures of Prime Neurology. There are totally 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, he would have acquired a good knowledge of neurology. We are on Prime Neurology Part 8, Stroke, Part 5, Evaluation and Prevention of Stroke. Evaluation of stroke. Although the initial management of acute ischemic stroke or TIA does not depend on the etiology, establishing a cause is essential to reduce the risk of recurrence. Particular attention should be on atrial fibrillation and carotid atherosclerosis because these etiologies have proven secondary prevention strategies. Nearly 30% of strokes remain unexplained despite extensive evaluation. Clinical examination should be focused on the peripheral and cervical vascular system. Routine studies include chest X-ray and ECG, urine analysis, CBC platelets, electrolytes, glucose, ESR, lipid profile, prothrombin time and activated partial thromboplastin time. If a hypercoagulable state is suspected, further studies of coagulation are indicated. Imaging evaluation may include brain MRI. Compared with CT, increased sensitivity for small infarcts of cortex and brainstem. MR or CT angiography evaluates the patency of intracranial vessels and extracranial carotid vertebral vessels. Non-invasive carotid ultrasound or cerebral angiography. It is the gold standard for evaluation of intracranial and extracranial vascular disease. For suspected cardiogenic source, cardiac echocardiogram with attention to right to left shunts and cardiac telemetry including long-term cardiac event monitoring are indicated. The causes of ischemic stroke are many. First, we shall discuss common causes, then the uncommon causes. Common causes: thrombosis, Lachner stroke, that means small vessel stroke, large vessel thrombosis, dehydration. When we come to embolic occlusion, it could be artery to artery, that is from carotid bifurcation or aortic arch or arterial dissection, or cardiac embolism. The cardioembolic strokes, example atrial fibrillation, very common. It could be mural thrombus, myocardial infarction, dilated cardiomyopathy, valvular lesions, mitral stenosis, mechanical valve, bacterial endocarditis. Paradoxical embolus, atrial septal defect or patent foramen ovale, atrial septal aneurysm, spontaneous echo contrast, and stimulant drugs like cocaine and amphetamine. The uncommon causes are hypercoagulable states, that is protein C deficiency, protein S deficiency, antithrombin 3 deficiency, antiphospholipid syndrome, and many others. Venous sinus thrombosis, fibromuscular dysplasia, vasculitis, non-inflammatory vasculopathy like reversible vasoconstriction syndrome, cardiogenic like mitral valve calcification, subarachnoid hemorrhage vasospasm, moya disease, and eclampsia. Primary and secondary prevention of stroke. Risk factors. Atherosclerosis is a systemic disease affecting arteries throughout the body. Multiple factors including hypertension, diabetes, hyperlipidemia, and family history influence stroke and TIA risk. Cardioembolic risk factors include atrial fibrillation or flutter, myocardial infarction, valvular heart disease, and cardiomyopathy. Hypertension and diabetes are also specific risk factors for lacunar stroke and intraparenchymal hemorrhage. Smoking is a potent risk factor for all vascular mechanisms of stroke. Identification of modifiable risk factors and prophylactic interventions to lower risk is probably the best approach to stroke overall. Antiplatelet agents. Platelet anti-aggregation agents can prevent atherothrombotic events including TIA and stroke by inhibiting formation of intra-arterial platelet aggregates. Aspirin in the dose of 50 to 325 milligrams per day inhibits thromboxane A2, a platelet aggregating and vasoconstricting prostaglandin. Aspirin plus clopidogrel. How does clopidogrel act? It blocks the platelet adenosine diphosphate receptor, and the combination of aspirin plus extended release dipyridamole. How does dipyridamole act? It inhibits platelet uptake of adenosine, are the antiplatelet agents most commonly used. In general, antiplatelet agents reduce new stroke events by 25 to 30%. Every patient who has experienced an atherothrombotic stroke or TIA and has no contraindication should take an antiplatelet agent regularly because the average annual risk of another stroke is high. In patients with minor stroke or TIA, a short course, that is 3 weeks to 3 months, 21 days to 90 days of aspirin in combination with clopidogrel reduces events, but long-term dual antiplatelet medications are ineffective and have higher rates of hemorrhagic complications. So we give a short course of 21 to 90 days. Embolic stroke. In patients with atrial fibrillation and stroke, anticoagulants are generally the treatment of choice. Anticoagulation therapy for non-cardiogenic stroke. Data do not support the use of long-term warfarin for preventing atherothrombotic stroke for either intracranial or extracranial cerebrovascular disease. Carotid revascularization. Carotid endarterectomy benefits many patients with symptomatic severe, that is more than 70% carotid stenosis. The relative risk reduction is 65%. However, if the perioperative stroke rate is more than 6% for any surgeon, the benefit is questionable. Endovascular stenting is another option, especially in those aged less than 70 years. Surgical results in patients with asymptomatic carotid stenosis are less robust, and medical therapy for reduction of atherosclerosis risk factors plus antiplatelet medications is generally recommended in this group pending ongoing trial results. Because the progress of asymptomatic carotid stenosis is less, the surgical results are less robust. So these are the wonderful concept of clinical evaluation of stroke. I hope you have enjoyed listening to this episode. The other important concepts of clinical neurology I have put in a book called Exam Oriented Clinical Neurology, written by me, Dr.Sreenivas, published by White Army. This book will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other book I have written is Focused Neurology, written by me, Dr.Sreenivas, published by CBS Publishers and Distributors. This book contains all the essential theoretical topics of neurology. So this book will be very useful for students appearing for orals or viva. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts. If you have enjoyed, please like, share and subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.